One of the issues with hip and groin patients is that variability of symptoms. So I just want to highlight a point regarding SIJ pain. So I have seen a couple of SIJ patients who presented with typical SIJ symptoms, but eventually ended up with hip pathology. So today was a case where I saw 65-year-old male, long-standing unilateral low back pain, had extensive physio input. He had occasional groin pain, but his main issue was more on the SIJ region. Now slowly the groin pain is getting worse, and he's having difficulty putting shoes and socks in the morning, limping after a while. So, and then sent for an X-ray, and he did have OA progression. So obviously it's a mixed picture. So what I find with many of these patients is once they start losing the hip mobility, it puts a lot of strain on the low back. They lose that extension, internal rotation, and around the SIJ. So another patient I saw early this week was a 34-year-old female, started getting a pain of a bit of stiffness and pain around the SIJ, especially when she was doing a lot of end range flexion yoga, and then at later it progressed into the groin region. So they sort of feed on each other. So if you have a patient with long-standing SIJ pain and it's not responding, then it might be useful to look into, is it the hip a contribution factor? Are you getting early symptoms of OA or FIS syndrome? And also with anything with SIJ, especially with young males, we should have a high suspicion of angst and those sort of inflammatory arthritis as well. So sometimes these patients get treated for a long time with back issues and SIJ, and the hip is not really evaluated, and because initially they don't tend to have much of groin symptoms, and later they progress as well. So next time you check out anyone with a long-standing SIJ pain, it'll be a good idea to make sure that their hip mobility and they're not getting any early signs of intra-articular pathologies. Thank you.